us support this report in totality. I thank you, Mr. Speaker.
Senator Cheraregei Samson.
Mr. Speaker, thank you very much. I want to commend the Committee of Health. I think, Mr. Speaker, in the last session when I was the chair of JLAC, the Committee of JLAC then defined Senate, who Senate was in that session. I think the Committee of Health, led by my elder sister, Senator Sheikh Omar, the Vice Chair, and her committee are continuing to distinguish the Senate. Mr. Speaker, I'll not get tired by saying whether devolution works or fail, it will only on the issue of health. If devolution succeeds, is when health succeeds. And that is why the Senator of Migori has insisted on very critical issues in terms of how health sector should be, Mr. Speaker. Mr. Speaker, it's so sad as I rise to support this report, and I want to thank the Committee of Health. I think if the...
You know, in other hand, I chair the liaison committee of the Senate.
Yeah.
And I've never met Senator Sheikh in that meeting, in the liaison committee. You send the Sheikh Omar chairs and the health committee. You see, the committee is led by the vice chair. Is led by the vice chair, Sheikh Omar. Is led by the vice chair.
Mariam.
No, I'm wondering how is the committee led by the vice chair?
But
that's my question.
You are the one moving this report.
Because Senator Mandago is the member of my committee.
I'll rectify. For the comfort of the House, my apologies, because I thought I said this report was brought in by the vice chair, Senator Omar Sheikh. And I thought that was correct, unless she didn't move it, if my memory serves me right. But I want to say this committee led by Senator Mandago, if that will please you. Mr. Speaker, what I wanted to say, and I was celebrating the committee, you know the committee is as good as the chair, the membership. Because I have chaired the committee, I want to encourage my younger brother that some of us ni chuma ya zamani. We have chaired most of this committee and we can exchange with him invaluable lessons moving into the future. Mr. Speaker, I am celebrating the health committee and I'm happy a number of them are here. I can see the vice chairperson, she's distracted, but I hope she will get what I'm just saying. I want to celebrate the Committee of Health for the good job that you are doing. What I'm saying, oh, you are a member, Senator Tabita and the rest of membership. Mr. Speaker, that's why I was saying, and I want to repeat so that they can get it clear. This session of the Senate will be defined by the Health Committee because they are doing extremely well. Mr. Speaker, I think as a chairperson of liaison, make sure they have enough resources to go round the entire, even Migori, the story is harder there. If we have hidden from the area senator, Mr. Speaker, that the issue of giving birth should be a blessing. It should not be a curse in our areas. I want to celebrate. I'm happy this report is so detailed that I'm shocked by the industrious nature of the health committee. Even they have told us that some of the pictures, that there is no paint. They are even talking about laundry. They have gone to the details. The devil is in the details, and that is what I like about this report. From lack of pain, poor laundry services, to the issue of drugs, to the issue of ICU facilities, Mr. Speaker. I want to say that when they visited Mutuapa Sub-County Hospital, when they visited Kilifi, I have seen the pictures, Mr. Speaker. Unfortunately, my report today is not colored, but I'm happy. I saw Senator Tabita in one of the photos, seriously looking at the drugs, whether they are expired or not, Mr. Speaker. And I think that is what is very important. And I'm happy with the way they are doing their job. I hope to host them soon in Nandi County, because there is a sad story. The reports were just tabled. They tabled Metete Sub-County Hospital, Nandil Sub-County Hospital, Mosoriat Sub-County Hospital, Mr. Speaker, that was just tabled a few minutes ago before you. It's a sorry state. For example, Metete Sub-County does not even one kaina, Mr. Speaker, to assist our women in case they go into complications. You can see to Nandil Sub-County Hospital. Out of almost 200 nurses needed, it's less than 70 that I know that are there, Mr. Speaker. Even there is no procurement plan. The issue of drugs, expired drugs, can be traced in Mosoria Sub-County Hospital. You go to Nandi Hills, you go to, and I think this is a problem because when you look at the Kilifi, and I'm told Kilifi County Referral Hospital Complex Phase 1, with a sum of 389 million. I wish the committee in future should have given us the status of that project so that we are aware what is happening. But I know these are issues that will come to Public Accounts Committee because they are living in the futuristic. So, Speaker, when you look at let me just go quickly to a few issues that have been raised, especially in Mutwapa Sub-County Hospital, Mr. Speaker. I'm happy. This is a 80-bed capacity facility. It serves almost 400 it serves almost 400 people, Mr. Speaker, and it is located away from Mombasa Malindi Road, Mr. Speaker. But they are serving 400 patients daily. That's a very huge facility, but they are seriously understaffed, which is very unfortunate, Mr. Speaker. There is also adequate infrastructure. I'm happy because even the committee have indicated, apart from medical, like waiting bays, pharmacies, stalls, Mr. Speaker, severe understaffing. Mr. Speaker, I would have requested this committee, because I'll make only 4 comments, and through the vice chair and the chair and the committee, however, here, you should have directed in your recommendation the immediate closure of this hospital. You know why, Mr. Speaker? Because the committee has said the facility pharmacy lacked an accreditation license from the Pharmacy and Poisons Board, which is likely to jeopardize patient safety and regulatory compliance. This was sufficient reason for the committee to order immediately closure of Mutwapa Sub-County Hospital. Because if they don't have this accreditation, Mr. Speaker, it is very unfortunate. I hope the mover of the motion, who is also the vice chair, and the committee's members who are here, they should be able to guide us, because I thought that is a sufficient reason to close. Mr. Speaker, the issue of salaries, the issue of incinerator, I think these are small things, Mr. Speaker, that we should not be discussing in the Senate Republic of Kenya. The issue we should be discussing in how to ensure KEMSA becomes efficient in terms of supplying drugs. Meru County Referral Hospital is suffering from serious issues. When we talk about the hospitals, Kibiricha Sub-County Hospital yesterday is becoming a serious issue, Mr. Speaker. I think the issue of incinerator was dysfunctional, Mr. Speaker. It's very unfortunate because the waste management you saw yesterday in, I think, Nyahururu County Referral Hospital in Laikipia had a similar challenge on how to manage the waste from the hospital. So, Speaker, the issue of staff salaries is they have not been paid for 2 months. I would have expected the committee, and I'm happy they have noted that the County Public Service Board should move with speed and ensure. Mr. Speaker, you know, here in Parliament, we also have interns and what you call temporary cleaning staff. These are people who live from hand to mouth, Mr. Speaker. It's small money to some of these big men and in county government of Kilifi. It is small to them because it might be 7,000, 10,000 shillings, but it means the world to those cleaners. I am happy the committee has directed that those cleaners must be paid within, and therefore, Mutwapa Sub-County Hospital, Mr. Speaker, it serves 100, and you know where Mutwapa is. Mutwapa is where life is in around Mombasa. And the people who like nightlife or nocturnal activities, Mr. Speaker, around Mutwapa will tell you what goes on in Mutwapa. You only see, but you don't see it anywhere else. So I hope, so that the 400 people who go there daily plus, Mr. Speaker, I hope the committee, I don't know whether the committee who are here members can direct, because these issues are very critical, that in future, the issue must, the governor and the county executive must be held to account, because looking at the money allocated, even in facility improvement, they have allocated a huge chunk of money, Mr. Speaker, that should be looked at, Mr. Speaker, for the benefit of the committee. As I conclude, is that I have seen under facilities improvement, a lot of money. Mr. Speaker, looking at Kilifi County Referral Hospital will be the conclusion. We are aware, I don't know whether it's backed by statistics, but it's suffering more than 1.5 million. It is similar problems that we saw in Meru County Referral Hospital yesterday. We saw in Kibiricha, we saw it in Nanyuki, Mr. Speaker, Nyahururu, all these hospitals, even in Nandi, Mr. Speaker, whether it comes up, whether it's Nandi Hills, the issue of staff is a problem. And I'm happy a report has been led by Majority Leader on some of these hospitals, Mr. Speaker. We have, and you know the problem I have is critical. For example, Meteite Sub-County Hospital needs almost 17 medical officers, but they only have 3. What does it mean? Poor service delivery. The issue of staff shortages, you can imagine Kilifi County Referral Hospital is the major hospital that serves 1.5 million, but they have challenges of staffing, Mr. Speaker. Mr. Speaker, I'm still shocked, and I want to appeal to the Committee of Health to order immediate closure of Kilifi County Referral Hospital because the hospital is operating without a valid pharmacy and poisons board license, Mr. Speaker. So who knows the quality of drugs, whether it's expired or not, Mr. Speaker? Well, you can see expired drugs, further expired drugs including injectables. Mr. Speaker, when I was growing up, I don't know whether malaria has lost its, the issue of malaria has lost its littleness. Because when I was growing up, the issue of when you are sick because...
Senator Mugatana, are you on a point of order? Or?
Mr. Speaker, I ask for intervention on a point of order. Is the Senator for Nandi in order to ask for a whole referral hospital to be closed? Does he know what that means? Can you imagine closing a police station, Mr. Speaker? Can you imagine closing a hospital, not just a hospital, a referral hospital? Mr. Speaker, is he in order? Is he in order to ask the committee to order such a thing?
So what if standing order has he violated?
Mr. Speaker, he has violated standing order number 1, Mr. Speaker. Thank you, Mr. Speaker.
Proceed and conclude, Senator Cheraregei.
Mr. Speaker, thank you. Mr. Speaker, I don't know. You know, can I read again?
That is a point of argument which may be...
Can I clarify to him? Because it is on the report. I want my brother, Senator Mungatana, which I have tremendous...
He will actually to contribute and he can be able to...
Yeah, I want to read the provision of the report so that he might also be with me on the same page. It says the hospital pharmacy operated without a valid pharmacy and poisons board license for both facility and pharmacist. And in fact, this report has pointed there is expired drugs, including injectables, Mr. Speaker. Injectables. But I thought that should worry us. Because if a facility is operating and giving out drugs, they will be killing more people than saving them. Mr. Speaker, some of us when we were growing up, we used to fear needles. Imagine a needle that is already infected, Mr. Speaker. So, Mr. Speaker, I am, Mr. Speaker, Mr. Speaker, you know even warriors fear something. They must fear something, Mr. Speaker. They must fear. So, Mr. Speaker, I want to appeal to the committee, and I'm saying I'm appealing, that is it possible to close down this facility because if they are dispensing expired drugs. Mr. Speaker, so in the unused medical drugs.
Do you wish to be informed by Senator Tabitha?
Yes, yes, please.
Okay, proceed.
Thank you, Senator Cheraregei, for allowing I inform you a bit. I'm a member of this committee. When we embark on the oversight role mandate that we do, first of all is to identify the problems and still as leaders offer a solution. We don't go to, negate and results and not really give credit. In those reports, I think we've really concentrated on the negative side. There are some bits of what is positive in some of these hospitals. These are some of the issues that we came across, but that did not warrant a committee to make a decision of closure. I'm just trying to inform him that our main goal is to try and see where the problems are and be able to guide the counties on how to improve. And lastly, Mr. Speaker, on the same, as far as the drugs are concerned, we realized that there were expired drugs that have been set aside and their value is so much, it doesn't mean that the patients who are being given expired drugs.
Senator Tabitha Mutinda.
Correct.
You will get your time to contribute to this motion.
No, I actually seconded. I don't think I'll be on the floor on this motion. I was just informing my brother on the issue that arose in terms of closing a level, such a hospital?
Senator Cheraregei.
I think I'm sufficiently informed. Would I rest it there? Mr. Speaker, because what I'm saying is very simple, and I love my colleagues, I love them back, and I want to assure them the information they are giving me is useful. Mr. Speaker, let the proposal, because we are looking for solutions, could it be possible at least the committee would have given them 30 days period so that they acquire this license, Mr. Speaker? Yeah. Mr. Speaker, imagine operating, and I know I will quickly, so that is my suggestion.
You are right. You know, as a chair also, even if I can't contribute, I must give also some direction.
Okay.
You know, if a facility has no license, Poisons and Pharmacy Board, yes. If no license, that should not operate. It is illegal. You're operating illegally. Yes. So that facility, the recommendation was maybe within a week to provide. And if you don't have the license to dispense drugs, and then you have expired drugs, are you saving lives or you want to kill people? Proceed.
And I agree with the dilemma the committee is, because they want to close an hospital, which is very critical, vis-a-vis that is not operating validly. And I agree with you, Speaker. The only option, I've read the recommendation, Mr. Speaker, in conclusion, is that they need to give us a way out. And I hope Senator Omar, when she will be replying, can give clarity on this matter. I hope she can give. On the issue of deterioration, the kitchen, Mr. Speaker, I don't know whether you can eat from such a kitchen. It's so poor, it's so dirty. From the photos, it's not well lit. I don't know, in that hospital, you get more sicker from eating from such kitchen, Mr. Speaker. Even paint. Do we need to discuss how to paint and clean our kitchen somewhere in Kilifi, Mr. Speaker? It's so unfortunate. Mr. Speaker, finally on the recommendations, I want to thank the committee for the issue of human resource. I think they have classified all those issues, Mr. Speaker. The recommendations are very good, especially on the issue of ambulance. That is why I want to ask the committee, Senator Mutinda, Senator Omar, and all other members of health. I don't know whether Senator Nyaituga is part of the health committee. She's not there. And maybe all of us. Can the committee now, what will happen in these ambulances? Have they put in place mechanisms to ensure that it's functional? Can we be able to track them? Because I have seen they have recommended that. The issue of medical waste, they have said incinerators must be built. Mr. Speaker, the issue of cleaning and making sure that the kitchens are okay must be. The issue of KEMSA, and I want to thank the President when he was in Logo, somewhere in Marsabit, he directed that KEMSA must do what we call last mile distribution of drugs, including in other these areas. The issue of waste management, the issue of human resource, I agree that electronic health records. Mr. Speaker, the issue of Data Protection Act, and I know Senator Mungatana will agree with me, that the committee also should have been very clear on the issue of data protection. You know the privacy and confidentiality of patients, and Senator Umtata has ever dealt with the issue of litigation of data protection laws, and I remember he was one of the serious litigators, Mr. Speaker, on the issue of data protection. So I want to appeal to the committee on this issue of ensuring that we have the health records. In as much as we are pushing for digitization, we must ensure. Mr. Speaker, I'm happy the committee has said they want inventory audits to remove expired drugs, but I don't know how you will track that, because Senator Mutinda has informed the House that they were there is expired drugs, but I don't know what became of it. We need to know whether those drugs were being destroyed, because we know in this country, people like shortcuts in this country, Mr. Speaker. You could go back and find that the expired drugs might be part in the system. So how do we ensure enforcement? And I want to call upon the agencies that come out, Mr. Speaker, so that they can ensure whenever the drugs are expired. You had the MP of Masab making serious accusations against Nairobi Hospital that he was being given drugs, that he was getting worse, but when he flew out of the country, he was not able, he was given drugs that were better. It was on record in the National Assembly, Mr. Speaker. So not all of Kenyans can fly outside Kenya. Even some of them cannot even drive to Arusha, Tanzania or Uganda. or even drive to Meru from Nandi. So how do we ensure, Mr. Speaker, that we ensure access to the issue that, and it is thanks to the Parliamentary Service Commission that he was able to get better medication. But is it possible all of us Kenyans, the Olopoloi, the ordinary Kenyans from Mulat somewhere in Bomet can be able to fly outside the country? German, Mr. Speaker. So, Mr. Speaker, with those many remarks, I support this committee report and thank Senator Sheikh Omar, the Vice Chairperson, and Mandago-led committee for the good job that they are doing. We want to see them next in Tana River, in Bomet, in Nandi, in Busia. Busia, we were there, and Busia is a crime scene. Mr. Speaker, with those many remarks, I beg to support.
Senator Esther Kenyuri.
Thank you, Mr. Speaker. I wish to support this report by the Senate Health Committee led by Senator Mandago and his Vice Chair, Senator Mariam Omar. The committee continues to do quite a lot of work which puts the Senate in picture. And I actually, I miss being a member of this committee because on many occasions we interacted with issues which Kenyans are facing on a daily occasion, Mr. Speaker. Mr. Speaker, the observations paint a very sad picture. And this is happening across counties, Mr. Speaker. We talked about Laikipia yesterday and Meru. Today we are talking about Kilifi. The situation seems to be worsening, Mr. Speaker. When you actually even look at the pictorials that have been shared by the report, it's a really sad situation, Mr. Speaker. Mr. Speaker, what is even more sad, in Kilifi Teaching and Referral Hospital, where there are 7 ambulances, 5 of them are grounded, Mr. Speaker. Only 2 are operating. So I'm really wondering how emergency cases are being handled if we have 5 ambulances grounded and they are being vandalized with the essential parts not there, Mr. Speaker. I think the county government of Kilifi needs to get more serious. If you cannot prioritize the health of your own people, where do your priorities lie, Mr. Speaker? Because most of the pictorials here are painting a very sad scenario, Mr. Speaker. You can actually see a mobile clinic which is actually lying there, and they're using it for storing expired drugs, Mr. Speaker. Ordinarily, this mobile clinic would be offering services in rural areas within Kilifi, but it's now grounded and being used as a storage facility for expired drugs. We have talked about the issue of expired drugs. Expired drugs are a threat to the environment and the people themselves. KEMSA, this is one of the issues KEMSA needs to crack the whip on. Apart from dispensing drugs to facilities, KEMSA needs to also come out and really see if the drugs they are giving to facilities are in use or what is actually happening. Though in Kilifi, I'm not seeing the issue of disposal, but the issue of having expired drugs is recurring, just as we saw in Laikipia and